Thank you, Bert. Ladies and gentlemen, good morning. It's really now for something completely different compared to the global overview you had in the session before the break. My task is now to tell you a little bit about developments in thinking about the welfare state and also in thinking about the difference, or you could say maybe the development between thinking in terms of the GDP or thinking in terms, as is proposed by many people, more in terms of the gross national happiness. As many people are working on the ideas that you should involve in bringing in more and more variables and more indices into the whole thinking about what a nation accomplishes and how people in a nation are flourishing or not so much flourishing at all. That's what my task is this morning, and I will do that not from a global perspective, but bring you to the Netherlands. You are already here, of course, and tell you a little bit of the problems of a society which is a welfare state, but for many people think, well, we are already on the brink of a post-welfare state society, a welfare state which has had a lot of successes, but also many problems in the last 10 years, last 6, 7 years. Of course, due to the financial crisis, to the economic crisis, this has become worse in the last years. So government had to do something about it and had to make new choices and provide new visions for the future. At least they tried to do that. Of course, there's a lot of discussion about this going on, not only in the Netherlands. I think this is what you see in all welfare states all over Europe and also in other areas of the world where they have welfare state type of societies. It's an inside view, so I will bring the ideas from the Netherlands, also trying to give you some idea of the developments we have in trying to develop new indicators to see how the society is flourishing, etc., and to see if we can measure some progress or if there is a slowdown in it or even going down in it, if we can see that. In the Netherlands this year especially, there was a lot of discussion about this issue. That was one of the sentences, you could say, most discussed in the State of the Nation of last year. The idea that the classical welfare state is going to be replaced gradually by a participation society or a participatory society. It's always difficult to translate that exactly into English, but give people an idea that the years of where they could rely on what the state would provide to them, what the state would provide them in benefits, in healthcare, in education, in all kinds of things that makes life more bearable, make life more easy, or make them worry less about their future, and that might be over. It was really worrying for many people that this could be the case, and people were really thinking, it's the end, and we don't have a welfare state anymore, it's over. It's not that bad at this moment. I mean, it's a little bit too early to say that is really already the case, but there is a development where you could say, okay, the classical period, it's the first time that the word classical was used in terms of welfare state. Most of it was a fully fledged welfare state, but the classical welfare state was the idea that something of the past that could not go on for the future. With the state as an agent of happiness, bringing happiness to the people, protecting them against poverty, providing healthcare, providing education, providing all kinds of facilities for welfare, for sports, for culture, for free leisure time, etc. Provide daycare for the children, all kinds of activities done by the government, done by the state, and paid for, of course, out of taxes. Also part of it is, and that's something discussed, is also, you could say, the government, the state as a moral entrepreneur, providing emancipation, stimulating the position, the enhancement of the position of women, of gay people, of migrants, etc. There's a huge system, you could say, built up after the Second World War where the state is the main agent in society and sees to it that it is important to bring a certain kind of happiness, although it's hardly ever mentioned like that, to society. At least the state feels responsible for that. The present government, a conservative and a coalition of Conservative and the Labour Party is reluctant to take that up and said, well, we have to do things differently. The one who has to, as a task to tell this to the people, is our new king. You see, he has gone to a wrong hairdresser, I would say, but okay. Well, he came into office last year, in 2013, and this was the first State of the Nation he has to read. I mean, it's part of our traditions that the king, or in the earlier days, of course, the queen, goes to Parliament, to a combined session of the Senate and the House of Representatives, and reads a speech where he tells what the government is planning to do for the next year and what the budget would be. It's about 15 minutes where he tells the Parliament this is what the cabinet is going to plan for the coming year. Of course, it's not his own words, it's not his plan, but he is you could say, the representative of the cabinet, and it's always a very festive occasion with chariots and 8 horses, etc., and things like that, and a lot of let's say, classical, regal presentation. So, but everybody listens to that, and it is really heavily discussed. It's always in the third Tuesday of September. It's a Tuesday because when it started in the 19th century, people had to come to Parliament from all parts of the country. And there was not that much of mobility in those days, so if they did it on Monday, they would have to travel on Sunday, and that was in a Protestant country a difficult thing because you could not travel on Sunday in many cases. So you traveled on Monday, and then Tuesday the king started the new parliamentary year by presenting the speech. But it's still a tradition to do it this way, even though if the trains run, you are in time in the morning. Well, this is the literal, this is, I could say, in this first speech, this was the text that we made the most brought about the most discussion, and also the most feeling of fear, of threat to the people, because people are so used to having a welfare state, a full-fledged welfare state with all these kind of benefits, all these kind of organizing social security. And this feeling that that's over is really worrying for people. People are really, could say, thinking of the welfare state as something that's self-evident, and when that's threatened, that's really also politically a difficult thing, of course. Literally, this was his words in the troonrede, as we call it, the State of the Nation of 2013. Gradually, the classical welfare state will be replaced by the participatory society, where everyone who is able to do so, very important thing, of course, is able to do so. Who is going to decide on that? When are you able, when are you not so able, etc. These are discussions that are already taking place. Is expected to take up responsibility for his own or her own life and for the people near to them. Who is near to you? Are that your children? Are that your grandchildren? Is that your nephew, your aunt? Or is it the neighbor? And one of the ministers said, well, of course you have to take care of your neighbors. Immediately a row, of course. I don't know my neighbors and I don't want to know them. We don't have any contact with each other. And some other people say, well, think about how Dutch people think about what you have to do then. If you have to move to another place, then you will see who is living in this building. There's an old lady above me. She's 85. Oh, I have to take care of her. No, you're not going to live there. Or if you are the old lady of 85 and you think, aha, young people around me, so I'm going to live in this apartment. It's not going to be like that, but this kind of discussion you immediately have, the feeling that you are pushed in a direction that you don't want. People do a lot of voluntary work. I mean, there's a lot of tradition in that. People do provide a lot of informal care. But as soon as the government expects you to do this and forces you to do this, people get into resistance mood and say, well, I don't want to be pushed in that sense. I do it for the people I like. I decide for myself who is near to me. These things, this kind of discussion, I mean, it's, of course, I exaggerated a little bit, but these are real vital discussions at this moment. What is social cohesion? What should you do in a society? And of course, for the government, it's very important to present people with an idea that it's not only that you have to reduce all kinds of benefits, reduce social security, to step back as a state, step back as a government, and say, well, you have to do it yourself. We rely on you. That's not just because of lack of money, because that there is a recession, because the government does not have enough money anymore, but that there is also an ideological idea behind it. It's not good for people that the state does everything for you. It's not right that you expect that the state will take up all the burdens of life, and all the burdens in society should be responsibility of the state. That's not right. And even you could say, the idea is a welfare state is too expensive to remain for the future. It's too burdensome for our economy. Costs of labor are too high, a very important issue in a country as much dependent on exports as the Dutch economy is. About 30% of our GDP is directly the result of successful export activities, so that's an enormous percentage of the GDP. And that's, you could say, that's threatened if you have to pay too much for the welfare state as a laborer, as an employer, etc. And the other thing is, and even the welfare state undermines the social cohesion in society because people do not look, they do not take care of each other anymore, but expect the state to do this. So there is an interesting combination of ideas of we have to step back, we have to reduce the welfare state, and on the other hand, and it's better that we do it because it's better that society takes up its own activities and takes up its own responsibility for each other. No longer service and support from the cradle to the grave. It was never completely like that. But also the question, many times discussed this year, but what exactly is then the participation or the participatory society? Because the government did not really be very specific about that. But the interesting thing is, the king gave his speech, and then the Minister of Finance goes to the parliament and presents the budget for the next year. And then many people expected that there was a big reduction in the money for the welfare state. Well, it was quite different. The whole budget was about 250, 260 billion euros for this year. And if you see it, the state is the welfare state. Most of what the state is doing is, at least in the Netherlands, is welfare state oriented. And it was like that, it still is, and it will remain like that. You could see it here yourself. Social security, about 80 billion. Our state pension system, everyone over 65 gets about 1,000 euros a month from through the state. That's your basic pension, and then you have the pension you have from the company where you worked or what you have saved yourself, etc. Only that is already amounts to 32 billion euros for this year. If you look at healthcare, 80 billion euros, which is quite a high percentage, with a 600 billion euro GDP. Why is it so much? Not because of the cure, not because of what's done in hospitals, not what's done by general practitioners, etc., but because we have a lot of care involved in our budget for health. Care for the elderly, care for the mentally handicapped, care for people with psychiatric problems, etc. That's a huge amount of money. It's about 40% of the total budget for healthcare is going into care, specific care tasks, where for many people would say, well, is that really things that have to do with health? If you live in an institution, it's part of, you could say, you do not pay rent. Living there is part of healthcare, and that's very expensive. Of course, these days it has already changed. You have to pay more and more yourself. When my mother in her old age was in a nursing home, she was over 90, she could not do anything herself anymore, she could not walk anymore, etc. But she had a good pension, and then she had to pay also a part of her pension into, you could say, the general, to the government for providing this care. And then she said to me, yeah, okay, I pay about $2,500 a month for care in this institution. But my neighbor, who only has the state pension, pays a few $100s. How is that possible? I said, yeah, ma'am, that's solidarity. That's what we call solidarity. And she said, yeah, but she gets the same services I get. I said, yes, but do you realize that staying for a month in this institution, in this nursing home, is about $8,000 cost? So even your own contribution of 2,500 would only be enough for just 1/3. We're about 10 days in this institution. Well, my mother looked at me and she did not really trust what I told her, and she voted for another party the next time. Now, but it gives you an impression of how much money is involved in these things. Education, it's all classical welfare state tasks: social security, healthcare, welfare institutions, education. The city councils in the Netherlands are paid, get their money from the national state, and also they have a lot of tasks in the area of the health of the welfare state. So if you look at what the government has to spend every year, 250, 260 billion euros, if dollars it's more, of course, then you see that it's practically for 60% at least, 60 to 65%, maybe even 70, 75%, depends on what you count into it, is welfare state money. And it will remain like that. I mean, this government will certainly not roll back and say, well, okay, you have to pay for that now yourself. The point is, it's the expenditures for welfare state rise too fast. That's the real point in the whole political discussion about these things. And you could say it's a huge system, it's a well-established system, it is an absolutely accepted system by the general public. And so even people who are the critics of the systems, and they are there in the politics these days, they are part of the system, they cannot stay outside the system because it's involved everywhere in life. If you're 65, you automatically, if you want it or not, you get your state pension. Even our former queen gets, she's 75 now, gets this 1,000 euros a month. She does not really need it, but you get it. It's the same for everyone. You could say it's the most, the most far-fetched idea of what a welfare state entails. For everyone, for the same amount of money, if you need it or not, but you are entitled to it. Healthcare is practically completely covered, although you have to pay more and more yourself depending on your income as extra, but the health insurance system is obligatory for everyone. Education, especially in the lower levels of education, is free, but if you go to the universities today, you have to pay more and more yourself, because people say, well, okay, you will earn that back later on, so you can do that. If I go to the opera, you have to pay maybe 100 euros for a seat, but you have to realize that the seat you're sitting on is costing that night about 250 to 300 euros. In costs to make that opera possible, and that's, of course, that's all subsidy by the government. By the way, if you are just in Rotterdam now, about 10 minutes from here is the splendid museum Boijmans van Beuningen. I'm in the supervisory board of the museum, so if you have free time, go to that museum. It's not expensive to get there, but it's very expensive to keep it up. I can tell you that. So I hope you will take time for that as well. And remember that it is very much supported by the population. Some people think, well, there is a lot of discussion about the welfare state, but the discussion in the population is not about is it not too much, but is it enough? And does it provide the services we expect them to provide? That's the discussion. And the problem for the government is, how could we stop the rise in expenditures? I mean, expenditures are much faster rising than the GDP is. That's the really problem with the welfare state these days. That's not only in the Netherlands like that, it's practically everywhere where you have a welfare state. You see that the welfare state grows faster than the economy. And Bart van Ark just explained to you how low the rise, you could say, the to be expected rise is in the growth of the economy. And you could say a welfare state is approximately twice that rate. If you look especially in healthcare, it goes up with 4 to 5% a year. And especially so in, I think, in highly developed welfare states. You could say, I think it's long underestimated in its consequences that people don't have a right to a job, but they have a right to an income. So if you have a recession, less people have a job, but more people will need an income by the state. So there is a problem. If you have a healthcare system provided for by a welfare state system, you see that this system automatically, you could say, expands itself. It covers more, it entails more people, it does more activities. It tries to keep up with other countries. Welfare states are competing with each other. Who is providing the best services to its people? Things like that. And the people who provide these services are generally on a higher level of education than the people who have, you could say, who are working in the industry, who are working in businesses and so on. So they have a higher income, they have higher expectations, they want to work in a specific way where the productivity is not growing as much, but where the salaries have to go up a little bit in the same direction as the people in more productive areas. It's the Baumol principle that Mozart symphony, you needed 50 musicians in 1790 and 35 minutes, and it's still the same. Only it costs a lot more. These musicians are much, much more expensive than they were in 1790. Of course, if you have your CDs, then you know how we have solved that problem, that you could not have your private orchestra anymore, at least not in real life at your home. I remember, and then you see the differences in that one of the women, the wife of one of the leading the chairman of Shell, the Shell company, was maybe in Qatar or in Dubai and so on, and had a dinner party with the sheikh there, and then he said, maybe you would like to hear some more music? I said, oh yeah, that would be nice. He said, well, and I expected that he would turn around and put up the stereo a little bit louder, but there was a complete orchestra sitting next to the dinner table, but she didn't see that because it was behind the curtain. And then you realize, of course, that's, for us it's practically unimaginable that you have your own private orchestra sitting behind a curtain at your dinner party. But in those countries, and with those money, it's possible, but not anymore in a welfare state. And the problem, of course, is that as soon as the economic growth is going down, and if you have, as they call it, negative economic growth, you go down. In 2008, our GDP was 600 billion euros. In 2010, it was less than that. It went down to about 580, 570 billion euros. And in 2012, we were back on 600 billion euros again. But in fact, we have become poorer in those 6 years. More people there, still some inflation. We have to pay more for all kinds of things we have to import from the international market. And we have become poorer. And so the same holds for the state. But healthcare, education, social security did not go down with 4 or 5%. They went up with 4 or 5% every year. That's what really entails, you could say, the problems of the welfare state these days, where there is not an easy solution other than to say we have to cut the budget, we have to prevent this autonomous growth to be so fast as it was until now. That's what the government tries to do. And that's, of course, it has an ideological framework where it says, well, and it's better for you if we do not pay for everything. And the other thing is what was forgotten or not thought through when the welfare state was installed in the 50s and the 60s especially, that if you give people rights where they have, you could say, access to money, then they change their behavior, they change their attitudes, they are redirecting their behavior into the direction of where the money is. That is not something bad. It's completely normal. You could say if you give people rights that entitles them to financial benefits, they change their attitudes, they change their behavior towards getting these benefits. That was really, you could say, out of a mistaken ideological idea that Dutch people would never do that. That was the idea. In the cabinet, there were really that kind of discussions in the 50s and the 60s. Nobody would do that. We had a disability law for people who could not work and were not yet on a retirement age. And the idea was, well, we give them about 80% of their last income. Of course, we can do that. How many people would make use of that? Maybe 150,000 people when they are 55 and have worked their whole life very hard and are completely cannot go on anymore, are really, in that sense, disabled. We will do that, no problem. Maybe 100,000, 150,000. In 10 years' time, there were 1 million people using that system and using this kind of disability benefit. So people were just, you could say, neglecting, you could say, how people really react to kinds of rights that are entitled to them. That's a very interesting thing, very interesting in the psychology of what's going on with people who are living in a welfare state. It was really underestimated. So here you see 3 things which I think hold for all welfare states, especially welfare states like ours, which are middle-class welfare states. So that you would like to see that people who are relying on the welfare state issues have a level of a standard of living which entitles them to, you could say, a continuation of the situation they were in before they had to rely on what the welfare state provides to them. Financially, but also in healthcare and education, etc. And we call it the Rhineland model. It's the continental model of the welfare state. It's a very generous system, essentially a very generous system, and it is based on the standard of living of the middle class. You could say that's the Christian democratic idea behind it, that it's very important to keep families together and to stabilize the status of families. That's, of course, you could say, a remembrance of what happened in the 20s and the 30s, when people lost their position, when middle-class people lost their safety net, you could say, and became poor. It's a discussion you see now, you see the situation, you see it's happening in Spain, you see it happening in Argentina. If the middle class loses its, you could say, its hold in society, loses the backbone of society, loses its position, it's politically and economically a very dangerous situation. And the whole idea of its welfare state is to provide the means so that people could uphold their position, their social status in society. Every adult person should have the means to have his own house, his or her own household on the level that would be acceptable in society as a totality. And also the number of households grows enormously thanks to welfare, thanks to prosperity, but also thanks to the provisions of the welfare state. If you look in this country, we have in 100 years' time, we have now 3 times the number of inhabitants we had in 1914. And we have nearly 6 times the number of households. And all these households want a house, want a car, want everything on their own, which is not very economically, of course, economical, but this is the way it happens. And thanks to the welfare state, thanks to the pension systems, etc., this was made possible. And then a specific Dutch system, mostly forgotten by most people, but it's very important. We had in the early 1960s, when the welfare state was established, we explored, for the first time, our natural gas resources. They were discovered in Groningen in the early 60s, and now we are about more than half of it is already depleted. But the government is very much profiting from the revenues of these gas resources. About 5%, still 5% of the state's budget, between 10 and 15 billion euros a year, is directly coming from the profit out of these gas resources. And in those days, in the 60s and the 70s and the 80s, it was about 10 to 15% of the government's budget. And that was spent on the welfare state. It was not saved, it was not put in a fund like the people in Norway do. They have huge resources and a very little population, so it's easier for them to do this. But we did the reverse, where we spent it on all kinds of services. It was never seen, you could say, by the people. It was not taxed from them. They did not have to pay taxes for that. It was immediately coming directly to the government, did not have to do anything for it, and they spent it on all kinds of facilities for the people. Now, today that's no longer feasible that we can go on this way. You see some kind of rather historical coincidences further or make some things more problematic in the whole system. So it's partly a problem what's typically for our country is, but what's also in other countries in one way or another, you can see and you can find it everywhere. People are struggling with what type of future for the welfare state is there? How could we go on in an international, more competitive situation where you have a state that has so many tasks to fulfill for all people living in that society. This is what the idea is behind it. You should rely less on collective solidarity. You should rely more on individual responsibility for your own life and that of the people close to you. It could also be financial responsibility, that you help them out, that you support them, that you provide more informal care, because we cannot provide everyone with care on a professional basis. That's too costly, therefore labor is too expensive in this country, and you have to do more in voluntary social engagement. Politicians always have the tendency to say, you should again do more, suggesting that in the past it was much more than today and that we should go back to the past. If we look at the research we did in our institute in informal care and voluntary social engagement, and so we said, well, it's even more than you already do today, because there is already been done a lot by the people themselves. But politically, it's more do it to a little bit, say, well, look what your parents and your grandparents did, and so on, you should do this again today, which is much more difficult, of course, in many cases. As, for instance, specifically for this country, when we started the welfare state, say around 1960, about 2% of the married women in the Netherlands worked outside the home. And most of them worked, as was in Statistics Netherlands terms was called, in the business of the husband. They were collaborators in the husband's business. Of course, there was a tradition that married women did not work. It was not really legally, it was not a law that you could not do that, but it was nearly a law, and it was practice. My mother never worked after she married, and when I was a schoolboy in the 60s, then it was in a Catholic school, so there were only boys in the class. There was one whose mother worked. And we considered his father to be a complete failure, of course, because he was not able to provide a good income for the family. That his mother was a medical specialist working on a high level was not of any interest to us. It was just as a child, it was completely normal for us that that your mother was at home, did not do any work outside the home, unless it was on a voluntary basis, just helping out disabled or sick people, etc., but not working for money. Completely changed. We have now one of the highest participation percentages of women in the world. And many of you know, of course, we are also world champion. And some say, well, that's not a championship, it's that you're losers in part-time work. 70% of the Dutch women who work part-time. But if you look at internationally, you see high labor participation in women is in practically all countries is connected to the possibilities of having part-time jobs. You could discuss a lot about that. I can feel that you would like to do that, but we do that at lunch or so. Yeah. You have to do more yourself, and you have to have a higher individual share in the cost of these. It's a two-sided approach, but I told you it's better to do it this way, and we have to do it because we can no longer go on the way we did. And that's an interesting problem for society, because now you get a discussion, yeah, exactly what we are looking for. What is a good life? What does happiness mean? What do we strive for as a society? You could say we were successful in providing everybody with an income, everybody with a good education, with healthcare, and with a pension and so on. So poverty is not a very big issue. At least it was not a very big issue. After 6 years of recession, it's again a little bit an issue, but not in comparison with many other countries. There is also a discussion, do we look at the right things? Is it good to look only at our economic successes, at GDP, etc., or should we look more into what is life worth in society? What is a good life? What is happiness entailed? Well, and then, of course, we always look over our borders, we look outside, and we went to Bhutan, the country with gross national happiness, the Kingdom of Bhutan. Oh, this I leave out. So, I have been there, so I can show you the T-shirt as a proof. And I do not wear it because this was the largest size they had, and it was the first time in my life that with my size, even the largest XXL was too short for me. Well. That was happiness for me. That's, yeah. Don't you have anything smaller? No, this is the biggest one we had. Okay. The gross national happiness in Bhutan. It's an interesting idea, and it was was taken up in many other countries as a good idea. Don't look only at the gross domestic product, look also at your gross national happiness. And the interesting thing was, I was in Bhutan last year, and the first night in Thimphu, its capital, at TV there was a speech of the new Prime Minister of Bhutan, Cherling Torgai, Top Guy, so it's called, and in perfect American English, he studied in Pittsburgh. He said, yeah, these things about gross national happiness, that's very nice for highly developed countries. What we need is gross domestic product. We need work. We have too many people who are not having any employment, not find any employment. We help our children now to study, and we don't have jobs for them. So he said, well, it's a nice product to export, these ideas of gross national happiness, but here in Bhutan, we are a poor country. Bhutan has about 700,000 inhabitants and a gross domestic product of about $2 billion. This is mainly a subsistence economy, people working hard just to have a meal at night. We don't want that for the future anymore. We do want that people have better lives. So it's very good, but our first task in gross national happiness is to see that we have a real gross national product. So I found it very interesting. You go there and you can look at it. It's a very beautiful country, I can tell you, and rather well organized. Very interesting to see that. People are placing their cars in parking spots. That's what not generally the case in Asia. Certainly not in Himalayan countries. But they work very hard to develop the country, and then the thing is, well, economy first, business first, jobs first, and then we will see to it that all the other things maybe are also in place as well. Still, they were working on it. They have made a certain kind of program for what we call the Bhutan Index, about 33 indicators for gross national happiness, with 124 variables. Now you see in what areas all these variables are. The idea is not to measure it on an individual basis, but collectively for the whole society. But I think if you look at it, you already see, and you don't even have to think about Bhutan itself as of course, a small country with a low level of development until now. But to identify the right indicators and to make them valid and to make them reliable. What variables should you use to assess what's really the case in psychological well-being, in time use? How would you decide if the way you spend your time is okay or not okay, is conducive to happiness or not so conducive to happiness, things like that. How to assess also the relative position of everyone in every instance on each of the indicators. What is more important? How do you weigh these indicators towards each other? And how do you collect the data? Because sometimes people think that it's easy to collect these data, but it's of course a very difficult task. You have to have real good statistics, reliable statistics, which is an issue in itself. I don't know how to do, but I don't know if there are people from Greece here. Yeah, okay. I always doubted the Greek mortality figures because they had a very, very high life expectancy. And then it turned out that, that the mortality statistics were not in order in Greece. So, but how much were they not in order? There are many, many ways where you could not accept statistics just at face value, that you really have to look into it. Sometimes it's very difficult to do a survey in a country where you don't know how many people are there or what their age brackets are, etc., is a very difficult thing to do, of course. And sometimes this is underestimated, and I see sometimes in international publications that all kinds of data are just presented as if they have the same weight, you could say, the same empirical substance, and that's not, of course, always the case. It's difficult to do this, to make a representative sample, to have good statistics, to have good independent statistics, also a very difficult thing. That's things you have to be certain of, to be able to do something like completing an index or developing an index like that. And then, of course, what is the relationship to your GDP? Because I think these two things always will have to be combined together. What is the level of your economical record? And on the other hand, and how is your gross national happiness, or you could say your gross national welfare index developed? To give you an idea of all these different indexes there are, I give you just, for our country, as an overview. Are we small? Yeah, if you looked at the size of the country, with a surface of 33,000 square kilometers, it's a small country. If you look at population, it's not that small. It's number 8 in the EU, in the European Union, in number of people. It's about 500 people per square kilometer. Is that good? Is that bad? Does that bring happiness, or does it bring just unhappiness? Many people think that if people are living in crowded circumstances, that's very bad for them. There is no real evidence for that. GDP per capita, quite high in our country. Luxembourg was in the European Union, is absolutely number 1, because if you don't have an income, you don't live in Luxembourg, you live in Germany, Belgium, or France, and you drive in the morning, and petrol is also very cheap in Luxembourg, so it's not very costly to do that. We were number 2, but we have gone down in the last years to number 4 or 5, and we are now comparable to Germany, Denmark, and Sweden in that sense. Is that bad? Is that good? Difficult to say. The GDP total should have been gone up, but did not do. Still quite high compared to the rest of the world. Export is very big in the Netherlands. If you have to break it down, it's very much many things. That more than half of it is it that you are, let's say, the mediator, you could say, between two countries, so that a lot of the logistics transport is done here. You don't earn a lot of money about that, but of course export is important. And in the EU we are, after Germany, the number 2 in export, if you just look at the numbers in billions, etc. The Global Competitiveness Index of the World Economic Forum, we were 1 year at number 5 because others didn't do so well. Now we are number 8 again in the world, which is not too bad, but We find it a little bit a pity that we lost it a little bit. Employment rate was very high, it's now a little bit lower. I think you see it changes in time, and it's always difficult to assess, is this good, is this bad, this is something you have to work on, or is it that you say, okay, we accept that it is this, it's still okay. You see, the European Misery Index, I always have to explain in the Netherlands that if you are number 1 on the misery index, you have the lowest level of misery. Yeah, because other people, many people in the Netherlands, I clearly accept you say we are number 1 in misery index. I always had that feeling. That's, yeah. So, the Better Life Index of OECD, this is a 7.8 score, the EU Happiness Index, and of course the Child Wellbeing Happiness Index, number 1 in the world. Many adults are not so happy with that, but that's a tradition. You could say even in the 17th century, people from abroad who came to the Netherlands complained about Dutch children because they were so free and everybody was looking after them and they could do as they liked, and they were not so polite as children in France, for instance, and that's still the case. Things like that, I mean, I just show it to you because you see there's a lot of discussion you can have about this. What is good, what is bad, what should you strive for? What is your, do you want to be number 1 on all of it? Is it okay if you're number 5 or number 8 or number 10 or number 12? And why would it be okay or why would it not be okay? It's a very difficult discussion in that sense. On the other hand, if you look, oh my goodness, time is going out fast, I see. If you look at it, you see what we are. I say always, we are the most southern Scandinavian country. You see, and all these indices on happiness, on well-being, on education, etc., countries, the Scandinavian countries, and mostly the Netherlands, sometimes Austria, sometimes Germany, etc., are always in the top bracket. Welfare, highly developed welfare state, highly developed modern economies, but also, you could say, countries with a lot of happiness involved there. And I can, if I have some time, I can show you a little bit how you see that all in these international comparisons done by the OECD or by the European Commission, etc. Here you see satisfaction with life and the misery index. Now you see highest are most of the time the Danish. The Danish are always a little bit above us in most cases. And then you see the Holland, Sweden, Finland, and you would not be surprised to find Spain and Greece high on the misery index, but quite satisfied with life, and Portugal and Hungary not so satisfied with life. And this is very strong evidence for this. All the time you see the same. Are you satisfied with life? Are you happy? Human Development Index. You see again Norway on top of it all, of course. Then Denmark, Finland, Sweden, Netherlands, Luxembourg, Ireland, and then Portugal and Hungary down there. If you look at satisfaction with life and the Better Life Index, you see practically the same. This is a rather tricky thing, but very interesting. Happy with life, with your own life, and then do you think that the quality of life in your own country is better than in the rest of the European Union? Tricky question, of course. Well, you won't be surprised to see that people from Romania and Bulgaria are not very satisfied with their own life, and know that it's practically everywhere better than in their own countries. That's why they, of course, are on the move to Germany, etc., and to the Netherlands. The Greeks are here. And again, here you find the Danish incredibly satisfied with their own life, practically passing the 100%, the best life of all, and knowing that it's nowhere better than practically than in Denmark, then Luxembourg, then Netherlands, Finland, Sweden, Austria, Belgium, Germany, France, Ireland, UK, Spain, Italy, etc., Poland. Interesting to see that. So people may be very dissatisfied with politicians and politics, especially in the case in the Netherlands in these days, but with their own life, their private life. And you could say life which was also made possible by political decisions and by services provided by the state. And they know better, but they do not say it if you just ask them in daily life. Happiness and GDP has also a strong connection with each other. You see the same kind of divisions. Here again, the misery index and the satisfaction with life. Okay, it's if you make all these kind of charts, you see in fact always the same thing. And I would like to, if I may, do I have a few minutes? Okay, 1 minute then, because I would like to present what I'm a little bit proud of, but I did not have time to go into that. What we do at our institute, the Netherlands Institute for Social Research, I was its director until last year, before my retirement. That is, we have developed already in 1974 a life situation index. It's a kind of, you could say, Bhutan index, but long before. And for many years was not taken very seriously, but the last 5 to 10 years you see that the interest in is very, very much growing. In domains as health, housing, mobility, etc. We have a number of domains where we try to assess the quality of life in the Netherlands. The assessment is on an individual basis, but not subjectively. It's trying to, let's say, to see how many square meters do you have for in a living area? Do you own a car, etc., things like that. And then bring that together. But the problem is, of course, I find it very, very difficult, is that we do not weigh the different indicators. So we do not say health is more important than mobility or leisure time. That's still to be discussed. That's still one of the issues we still are working on. And so this will be then, I think this time, the last time. If we look at it in time, then you see there is a development visible. So you see that people with a high income do still better, but that people with a low income have come up a lot, from, you could say, 20 points. This is the book you could, it's also on the website. Everything our institute, SCP, does is also on the website. Partly, this is completely in English. Many things are partly in English or with an English summary. And you could also assess your own life situation index by answering the questions. It's also in English available. I did my own score yesterday to see how what my assessment would be. Well, you see, my life situation index is 130, and it says, and then they gave me that score and said to it, best 1% of the Netherlands. So you see, this is the best to be a researcher and to be the director of the institute. He provides you with the best results. Okay, I think I will leave it with that, but I hope that you will have time and that you will be interested to look into what we try to do for already 30, 40 years approximately, and to find ways to, you could say, to complement the whole idea with of measuring the GDP, with also with the life situation index, with the happiness index, which is not completely subjective, which is important. I mean, the subjective assessment is also important, but gives some real information, which is also for policy means very important, that you know how it is with mobility, with housing, with health, with education, etc., with the income of people, and that you make a division between the frame with this, that's age, gender, income, education, and then the different domains which you could make an assessment of the position of a country, but also of the position of individual people. Thank you for your attention.